everyone, this is Shruti Ahuja. So in this video, we are going to talk about lymphatic system. This is a part of the revised general anatomy with me series. So here we are going to revise in a different manner. I hope you will like it. So first of all, let's see what are the components of lymphatic system. So let's learn it with the help of a story. For example, there is a interstitial space. Here is a pool and you have to collect some liquid from here. So here are my the capillaries, the lymphatic capillaries, right? I have implanted these pipes here basically. So from this pool I have to suck the fluid, and this is the basically interstitial space, and here are the capillaries, right? Now from the capillaries I will take it somewhere else, which is the lymph vessels, right? Just like we have veins, we have arteries, here we are having the lymphatic vessels. And from lymphatic vessels I have some checkpoints from where I have to check the fluid is free of bacteria, free of any virus or protozoan or fungi. I have to check at multiple checkpoints. So that checkpoints are called, guess it, they are called lymph nodes, right? So lymph nodes. And from these lymph nodes it can also go through a set of another lymph vessel, then another lymph node, and finally it will drain into the thoracic duct, or the thoracic duct, or directly into the jugular veins, right? So we have different drainage of the both sides of the body, right? So these are basically, we can see the components. But here is one more important component, which is the lymphoid organs. Just like I have these lymph nodes, small plants where I have to check about how is the quality of the lymph. I need to have a big plant which is called lymphoid organs. Lymphoid organs can be primary or secondary. Primary are bone marrow and thymus, and secondary ones are spleen, the spleen, and basically the lymphoid tissue, which is the GALT, and gut associated lymphoid tissue. And these are basically the lymphoid organs which we are having. So next we move on to the functions. There are three functions. One we always know, already know, right? That is immune function. It provides us immunity. How? I told you, na? They are lymph nodes, and these are the checkpoints for various pathogens. Next is the excessive tissue fluid which was there in this pool, that is the interstitial space. It is collecting that. And the third is that is related to the gut. In gut we have lacteals. In lacteals they are lymph vessels, the capillaries basically, and from there they help to transport the fat. It helps in fat absorption and carrying it to the systemic circulation and to the other organs. So this was about the components and functions. Next, let's compare the lymph capillary versus the blood capillary. The blood capillary, we know what it is. Basically, it is a junction. It is a junction between the artery and the vein, right? We all know this. But in artery and vein junction, we know that it is open from both the ends. But lymph capillary is open only from one end. Basically, it is like a blind sac, like appearance. It is blind from this end, but it is moving to the lymph vessels. It is continuing to the lymph vessels, right? So I can see this is blind, opening, this no opening here from one side, but it is open from both the ends. Next, what do I see is like these are small. We all know capillaries are very small, right? The blood capillaries, but these are large. These are regular, but these are irregular. So this is the difference between the blood and the lymph capillaries. Now the third point of difference is permeability to molecules, which is permeable to the bigger molecule. In artery, the blood capillary, we know it helps in the diffusion of gases, nutrients and everything. But do you remember that in gut we are having the blood capillaries also and lymph capillaries also. But if blood capillaries are able to extract all the nutrients, then why do we need lymph capillaries? Why do we need that lymph capillaries? For fat, right? So fat molecules are bigger. So basically lymph capillaries are specialized because they are permeable to bigger molecules, but blood capillaries can't pick up the bigger molecules. So here we are done with the third point. Next comes the drainage factors. This is also an important point. So this can also be learned with the help of very easy method. Now just remember that there is a factor of muscles, of contraction, the muscles, and there is another factor of pressure. So muscle is one side and pressure is on the other side. Muscle and pressure. In muscle I am contracting. So in first I will see the contraction of smooth muscle, right? Smooth muscle contraction. Second, arteries also have smooth muscle in their wall. So second point will be pulsation from arteries. Right? Third point will be the massaging action of muscles. Massaging action, what will provide it? The skeletal muscles, right? The skeletal muscles are also working, right? That will provide us the massaging action. Next is, I can see fourth is, how do you do the respiration? We need muscles for that, right? Or the thoracic muscles are used for respiration. So here also muscles. Now pressure comes. Pressure is the negative intrathoracic pressure is first, and negative intrathoracic pressure. And the second is the filtration pressure. So here we are having the 6 points, and the 7th is valves within the lumen of the lymph vessels, and it is the same as the venous one. Now if you compare, the venous drainage and the lymphatic drainage factors are almost the same. Now I would request you to find 3 more factors and write in the comment box. That will help me and you as well, because we need at least 10 factors if we want to write a 5-mark question. Next comes the drainage plan. So it can be explained by this way also. That is, first we are having the interstitial fluid. From there we are having the lymph capillaries, and then the larger lymph vessels, and then afferent lymph vessels to the lymph node, and then the efferent lymph vessels to the lymph node, and then we are having the lymph ducts. I told you the thoracic duct, and there are various ducts and trunks. These are basically the bigger lymph vessels, we can say. Next, at last, 2 large ducts are formed, the right lymphatic duct and the left lymphatic duct. The right one will drain into the angle of the right internal jugular and the right subclavian, and left one in the left internal jugular and the left subclavian vein. So this was about the drainage plan. Last comes the clinical, right? In clinical we are having lymphangitis, then lymphadenitis, and third is elephantiasis. Now you can guess what is lymphangitis. So I can tell you by breaking the word, and we have to learn by this method only. So lymphangitis, itis means inflammation, and means vessel. So it can be any vessel, right? So if there is inflammation of the lymph vessels, so that will cause a kind of blockage in the lymph drainage and flow. So it is caused by inflammatory condition of the skin caused by bacterial infections. So there will be inflammation of the lymphatic vessels. We can also see the red lines wherever there is lymphangitis, and also there is enlargement of nearby lymph nodes, and also it is painful. Next is lymphadenitis. Here also you can guess itis means inflammation, right? And lymph we know. Now adenitis is basically the lymph node, right? If there is any bacteria, virus or fungi overload and it is blocking the lymph node, and if the lymph node is blocked, then lymph will not drain, right? There will be overflowing, right? So because if I close this checkpoint and the lymph will overflow, right? So that is about the lymphadenitis. It is basically the lymph node and it is the lymph vessel. We can know this easily by the names. Third is elephantiasis. Elephantiasis, we all know, if the adult filarial worm basically is lodged in the lymph vessels, then there is a blockage of the flow of lymph in the feet and the lower limb. So that is the elephantiasis. And elephantiasis, it is known because the limb looks like a elephant leg or foot, we can say. So this was about the lymphatic system. Now last, there are two more points, important ones. Name the sites where lymphatic capillaries are absent. So first of all, think of where we don't want to drain the extra fluid. That can be, think from where does that extra fluid comes. It comes when there is like leakage of fluid from somewhere, right? How is that pool being filled? That pool is being filled because someone is leaking some water right here. Some water is coming here. From where does that water comes? We can say that fluid comes from the we can say the blood system and the blood capillaries, right? That fluid is leaking out from there. So it is just cleaning that fluid from the pool because this area should remain clean. So we can say that the avascular structures where there is no blood supply, we don't need lymphatic capillaries also. And just to name them, that is epidermis, cornea, nails, hair and cartilage. Next is spleen and bone marrow, alveoli and respiratory bronchioles, and brain and spinal cord also don't have that lymphatic capillaries. The primary and secondary lymphoid organs I have already mentioned, and this was all about lymphatic system. If you like this video and this way, and again to mention, these all are important questions whichever I have discussed in this way, and if you liked it, then do save it in your library and share it with your friends because sharing is caring.